So today we are going to talk an emergency topic, that is sepsis and septic shock. Okay, this is very important topic. So basically, what does sepsis means? Okay, one definition. Sepsis mean. Sepsis mean it is a condition in which organ dysfunction will happen. Organ dysfunction will happen because of the response to the infection. Response to the infection. So basically, what will happen when infection enter into our body starts fighting to the infection. Okay, like we have different types of in WBC, neutrophil, eosinophil, basophil, lymphocyte. So everything have their function according to the condition. So what will happen? The infection has the strength to move forward throughout the body. Okay, throughout the body, it has the ability till the body response is it's spreaded all over the body within 2 to 3 days, 5 days when body reacts. So initially 3 days, it's it is uh, completed throughout the body. It reach all part of the body, but mostly lungs are affected in initial state. The patient will have respiratory distress or he have pneumonia. Then afterwards we have other organs will be affected, that is heart and later kidney. Okay, these are the, then if untreated it will also reach to the brain and it will damage the brain. Okay, so basically it will spread all over body and it will harm the organ. Okay, so this is nothing but sepsis. What is septic shock? Septic shock, in which what happened that every metabolic activity will happen in abnormal way. Okay, or circulatory system abrupted. Okay, and cellular dysfunction will happen. So all these three combined, and and the BP of the patient is decreased. Okay, decreased. Okay, so in these three conditions we have to see that this patient went to septic shock. Okay, so due to the infection, the circulatory, cellular dysfunction, metabolic abnormality, and mean arterial pressure is less than 65, then it is confirmed that this patient is affected with septic shock. Okay, so this is the reason we have to understood this. Basically, the reason is infection. Okay. Next reason, what is the reason? We have to know that infection, mostly the 50% of the chances of the sepsis is due to the pneumonia. Pneumonia, okay? Or then abdominal infections or genito urinary infection, UTI infections. So these are the most three types of common infections which affected the body and it spreads throughout the body and make septic shock. Okay, so what type of blood test you have to do? You have to do blood culture. In that, we will know that what type of bacteria is present in our body to treat with that bacteria. So here we have two types of bacteria. One is gram positive and gram negative. So mostly gram negative bacteria will affect the body, 62%. How many percent? 62% gram negative. What are the gram negative? Examples are given here. Mostly common. Pseudomonas aeruginosa. Aeruginosa. Okay. Okay. Klebsiella E. coli. These are the most common gram negative bacteria. Gram positive bacteria, Streptococcus, Streptococcus pneumoniae. These are the most common. And 19% are fungal infections. Okay. So 62% gram negative, 47% gram positive, 19% stronger. So these are the reasons behind septic shock. So basically, in the United States, more than 2 million cases in year have shock cases. Okay, in 119, I mean 30% of cases. Okay, it will mostly increase by 50% in coming days. Okay, because why it is happening? Because of our food. So we are using uh, not healthy food, mostly not healthy water, air, mostly food. Due to the food, it is spreading, in my opinion, because we are putting the food, keeping the food mm, into the fridge, refrigerator, deep refrigerator, and as well as we are using the food which is kept in the deep refrigerator after multiple days we are using. So this is the cause, and water, free refrigerator water, and the mostly unhealthy diet which is coming into the market, okay, which have number of infective things into the food. Okay, and other thing is that contaminated water. Okay, and fourth one is the non-veg, mostly non-veg like fish. Okay, and chicken. Okay, then after mutton also. So mostly these are the rings. They are the things which have the bacteria. Okay, the bacteria what they eat by the uncontaminated food are given uh, for their growth. Okay, so it may be the reason. What will happen that when the pathophysiology, what happened that it will make inflammatory changes in the body, mostly in the inflammatory response. Okay. So whenever infection enter into our body want to fight with that infection. Due to the process, what will happen? The inflammation will happen. Inflammation happens, then what will happen? The metabolism can't be happen in normal way. Okay. Organ or cell or tissue cannot get proper nutrition, proper oxygen, or other things. So what will happen? This leads to damage of the cells, and after cells damage, the abnormal and metabolic waste is gathered into the body. Okay, so gradually the body will went into the sepsis. Okay, this is the pathophysiology. So what will clinical features? Patient have respiratory effort, okay, mostly difficulty in breathing, okay, and he have hypotension. Second is if the patient have if the infection will reach to the kidney, what will happen? The kidney symptoms will be seen, difficulty in urination, burning in urination, etc. And if the patient went to the infection went to the CNS, central nervous system, you can see coma, delirium, CNS related issues, sometimes epilepsy or seizures. Okay, so the other you can see that clinical features. Okay, how to diagnose? Basically, there is no golden standard to diagnose the sepsis, but you have to see the patient. Okay, organ or lab or vital signs, which will give to the you will give you the representation that you have the problem. Okay, and we have the different types of lab tests. We have to see the values: CBP, LFT, CRP, ESR, CUE, all this. It is because it is the ICU case. I will not go into detail. Okay, but here we have to know what is septic shock. So wait, we have to identify the septic shock. So in this, they administered higher antibiotic, broad spectrum antibiotics. Okay, for every 1 hour delay the initiation of antibiotic administration. Okay, so These are the we have the number of antibiotics, piperacillin, molybdenum, high antibiotic, immunocompetent adult septic shock, neutropenia. Okay, in that we have other different types of splenectomy if it happens, what type of antibiotics you have to give. So these are the different types of antibiotics. What is the prognosis outcome of the patient? So meanwhile, 20% are mortality rate. 20% will die. Mostly 80% are surviving. Right? Is there? Okay. But they will have some different functions like physical dysfunction, neuro dysfunctions, and they have low quality of life because of the function is spread all over the body. Okay. This is the thing you have to understood. So what the prevention you have to take? So you have to take to avoid. Basically, you have to take good food, healthy diet, and good quality water to intake. And mostly, you have to avoid unnecessary use of antibiotics. So this book, Harrison, is a good and which have acceptance in all the medical field as well as both uh, both type all the type of doctors. Okay. So basically, his prevention is to avoid. This is the one line you can read that avoiding unnecessary antibiotic. So nowadays, everyone is prescribing. Mostly doctors are prescribing antibiotic. Here, to avoid the sepsis, you have to avoid antibiotic because your immunity will suppress higher user of antibiotic. So this is his request to us and minimizing unnecessary immunosuppressants. So regularly number of persons take immunosuppression, some diseases they need, but here he is advising them. Okay, and we have to control the infection. We have to follow the protocols to control the infection, greenness, neatness, and unnecessary water cannot be on the roadside, on the in the home to be cleaned regular basis. Okay, so this is the condition. This is the thing you have to do to prevent the infections. Okay. So I think you understood about sepsis and septic shock. So basically, this is due to the infection and it will spread to all over the body and it will affect the dysfunction of the organ. You have circulatory issues, cellular dysfunction, and metabolic disactivity along with mean arterial pressure is low, less than 65 mm of Hg. It is affected mostly respiratory system, then afterwards abdominal system, and we have urogenital issues. Okay, in that we have negative, gram positive, and fungi. Most common is gram negative. Okay, now so this is the thing you have to know that about sepsis and septic shock. Okay.